This, very sadly, is the last event in our Introduction to Aviation and Space Medicine lecture series. We've got Eleonor Frost with us today, who is in fact one of our very own. She's an Aberdeen medical student and she's also a member of the committee. And she'll be talking to us today a little bit about space tourism and the project that she did with the Paraboladies, as I've mentioned here. But I'm not going to talk for too long because Eleonor herself is going to introduce herself and describe what she's going to be talking about. So without further ado, Eleonor, over to you.
Thank you. Let me just work out how to share my screen. Okay. Is that working for everyone?
Yep, that's perfect.
Awesome. So thank you very much all for coming. In summary, the title of my slides got a bit better from some of the information that we put out, because I'm just going to focus on space tourism and the pre-flight checks that we're doing for tourists. So you've got the rest of the Paraboladies underneath there as well, Lauren, Maya and Nina. So thank you to them because we put this whole presentation together. So a little bit more about me. I did a bachelor's in physics and medical physics at UCL. And during that, I did a module in space medicine and extreme environment physiology, which is where I met Maya. And we put together a team for the Student Aerospace Challenge, where we were addressing the pre-flight checks that space tourists would need. I'll go into a little bit more detail about that later. I also got to do my dissertation on a space medicine topic, which was an investigation into the feasibility and design of a microgravity surgical workstation, which is a mouthful, but was a really interesting experience. After that, I spent a year working as an assistant researcher for ICET, which is the International Space School Education Trust. And we got to design the experiments that kids had put forward and actually launch them to space, which was pretty cool. In terms of other things I've done, there are a few pictures here. We got to present at the UK Space Conference. Down at the bottom is with ICET. So the kids come in for a week of outreach and they design their experiments with the help of 2 astronauts. And then on the right, I put that in because I knew that Adele would kill me if I didn't, but I got a very cool opportunity to work with Adidas on a campaign they were doing for a shoe that they were launching to space. Some of the other stuff I've done as well, I submitted my dissertation to the British Interplanetary Society Student Paper Competition, and they funded me to go to the International Astronautical Congress last year, which I highly recommend if anyone wants to get into the space industry. I'm also working as a student leader for the Women in Aerospace Medicine group, which is a new initiative, so please follow them on social media. And I'm the vice lead for the Space Generation Advisory Council, Space Medicine Life Sciences Group, which is a lot of acronyms, but it's a great organization for anyone who wants to get involved in space medicine. And as Adele said, I'm in my first year of studying medicine at Aberdeen. So in terms of the content of this talk, I'll focus first on what is space tourism in the past, what it's been, what it currently is, and what the future directions it can take. And then I'll talk about how will we assess space tourists for fitness to fly, and we'll go through some hypothetical case studies. So hopefully there'll be a bit of an interactive element. First of all, so I've got these infographics from Space Aeneas. And there's a lot of information, but the main thing I wanted you to focus on was the fact that there have been upwards of 500 people gone to space. So this actually dates from 2018. There's been a few more since then, but only 7 of those were space tourists. So that's classed as people who paid for a ticket to go to the International Space Station. Now, the definition of space on the left is above 100 kilometers, and that's what a lot of the suborbital spaceflight providers like Virgin Galactic are using, but they've actually now decided to use the American definition, which is 80 kilometers, because they don't have to go as far to get to space, essentially. So a little bit more about those tourists. The first one was Dennis Tito. He went up to the ISS in 2001. And interestingly, actually, he only spent, like, as you can see on the right, a week to 2 weeks up there, and none of them have really done any long durations on the ISS. The 4th tourist was the first female space tourist, which was Anushay Ansari, and after that we had Charles Simonyi, and he actually went back. So he had 2 flights to the ISS and is the only repeat space tourist so far. And finally, the tourism flights stopped in 2009. The final one was with Guy Liliberte, and that is because the space shuttle was retired and the seats on the Soyuz spacecraft are very expensive, so they haven't organized any tourism flights since then. So some of the future perspectives, obviously this was published in 2018, so they had predicted to be flying by 2019, but as with many space projects, there's always delays. One of the most promising providers is Virgin Galactic. They've got their Spaceship 2, which is what a lot of the medical checks that we'll be talking about later is based on, which will give 5 minutes of weightlessness and is a suborbital flight, so it doesn't hit orbit and orbit around the Earth, it just goes up to the limit of space and back down. The next one is Blue Origin, and they're also proposing the same thing, but their vehicle isn't as advanced as the Virgin Galactic. Then finally on the right, we've got some pretty exciting missions, although they're quite far away, over to the moon for space tourists. So definitely something to keep an eye on. So next, I wanted to play this quick video. This is the second flight of Virgin Galactic, and it actually had the first passenger on board. It was Beth Moses, who was part of the Virgin Galactic team, so not technically a space tourist. But I want you to picture yourself in the Mojave Desert going on this flight and seeing what it could be like. Let's see if this works. Hopefully you've got sound.
Release, release, release. Fire, fire. Welcome to Space Scotland. Congrats, Steve. Welcome to the club, astronaut. Thanks, Space. I like this club.
So I hope you enjoyed that and you enjoyed the little surprise at the end as well. Oh no. How am I going to get out of this? I'm going to have to, sorry, technical issues. I might need Adele's help on this one.
Try pressing escape on the keyboard.
Okay, great, thank you.
I'm going to start from the next slide.
Okay, great, hopefully that's all good. So the next part, I'll talk about how will we actually assess the space tourists that are wanting to go on these flights. And an interesting study came out in 2019 saying there are currently no medically binding criteria for participant suitability. So that means currently anyone could get on the flights and go. Now that is with the caveat that the commercial providers like Virgin Galactic possibly aren't publishing the kind of criteria that they will be putting in place. And the other thing to highlight is also, I'll be using participant for the rest of this presentation, but it is quite a debated topic as to whether space tourists should be called space tourists or commercial astronauts or something else. So I'll be using participants, but that's quite a debated topic. So I'll be going through the kind of checks that we're looking for in the context of the challenge that we did. So we took part in the Student Aerospace Challenge, and for that, you can see on the left, we had to determine the medical checks for safe participation, but also to maximize the number of participants, because this is a commercial endeavor, so they will be wanting to sell tickets, and then propose any in-flight solutions and countermeasures. We definitely assess that providers have a duty of care to screen and define the risk of participation, and then what they do with that information afterwards is also undecided. So we started off with a literature review, and that focused on 3 main areas. So how the flight will affect the physiology or the body of participants, how it would affect any disease states, and then any conditions that means that someone shouldn't be allowed to fly. So to start with, we had to define a possible flight profile. There are a lot of different theories out there as to what the final flight profile will look like, but we just focused on a simplified one so that we could base our medical criteria off of that. So we have a single parabola that's reaching 110 kilometers. So that's if they want to get above the 100-kilometer mark. But as I said earlier, they might be changing that to 80 kilometers. The max speed is 4,000 kilometers per hour, which is about 5 times the max speed of a Boeing 747. And oscillations of 10 hertz and noise below 10 decibels is within sort of acceptable guidelines from NASA. And it's also the kind of thing that you might have on a commercial aircraft. Radiation levels of up to 7.5 microsieverts are pretty minimal, and we'll be talking about the effect that could have on the body later. And the full duration of the flight is 150 minutes, but you only actually get 3 to 5 minutes of microgravity. The rest of the time, you'll be under a load of up to 3 Gs in the chest to back direction. So that's going through your chest towards your back. That's called GX. Finally, the cabin pressure will be similar to an airline flight, which gives it an oxygen content of about 15.4% at sea level. The unique thing about this flight profile is that there's no way of simulating it until you get on the real thing, because we have parabolic flights that can give you the microgravity portion, but they won't give you the high G forces portion of it. And we have centrifuges, but they won't give you the microgravity part. So just a quick refresher, G-forces, if you look at the 3 directions they could be, I think you might agree that GX is one of the preferable ones, because GZ, you'll feel like you're being stretched out or squashed down, and GY will be side to side, which would be a very strange feeling. And GX, positive GX is from chest to back, so that's something that you can just, you'll get pushed into your seat, but you should be able to withstand. And on the left is the suits and the seat that they use on the Soyuz. But of course, as we won't be flying astronauts, they won't have these kinds of suits. They're still yet to decide what they will be wearing, but the seats will definitely have to accommodate them being pushed into it. And it could also, there's proposals that seats change in order to change the direction that G-forces are put in to make it a little bit more comfortable. So really the only existing pre-flight checks we had to go on are those for commercial airline travel, because there isn't really anything like this out there. And currently anyone who's mobile, not in hospital of course, and stable with chronic disease is allowed to go on a flight. But they've actually found that 90% of in-flight deaths have occurred from a previously diagnosed condition. So there's the question of whether, if they had more checks in place, could they prevent those? But then obviously you would be making flying more restrictive. There are actually no explicit factors to predict how someone will deal with a commercial flight as well as a suborbital flight, but poor pre-flight exercise tolerance is definitely an indicator of someone that could struggle. Some of the at-risk patients that participants that we would see is anyone with deep vein thrombosis, COPD, embolisms, that kind of thing would definitely be at risk on a commercial flight and therefore on a suborbital flight. Interestingly, a lot of our research highlighted that neuropsychiatric complications would be one of the determining factors as to see if someone could deal with a flight or not, but that would obviously vary on an individual basis because it's such a spectrum. So the effects of flight on the healthy human, we'll start with this and then we'll go on to what the effect of a suborbital flight could do to someone who's not necessarily the healthiest. So to start with, the radiation levels, you would only actually have to do 10 flights to get the equivalent of 1 chest x-ray. So the radiation levels are pretty low. And as we said, they're 7.5 microsieverts. And current guidelines is that 1 sievert increases the risk of cancer by 5%. So if you do that calculation, these flights would only increase the risk of cancer by 0.00004%, so not very much. But the guidelines are very different for pregnant women and children. So we did put in our recommended checks that participants be over 18 years old and not be pregnant. Next, the acceleration. So this is the G-forces. They'll be increasing on the way up. And of course, then you have microgravity, and then you have up to 3 Gs on the way back down as well. And when they did do centrifuge tests on a portion of population, 6% of people actually elected to discontinue the centrifuge because they felt discomfort or the high G-forces were causing anxiety. The noise and vibration levels are kept within acceptable levels from NASA, so that's not really too much of an issue for a healthy participant. But the cabin and air pressure content will be like on an airline flight. The pressure changes, thanks to Boyle's law in physics, will create volume changes, and so that could cause an issue if someone has enclosed space like in your sinuses and things. That's the kind of thing that you feel on a commercial air flight, and obviously that will be amplified on these flights, so it might not be the most comfortable, but shouldn't cause any issues either. Now the microgravity part is probably the most exciting part, but it's also only 5 minutes worth. So the only effects that would really have, the first would be a fluid shift. So you get a significant shift of fluid from your legs up into your chest and head. Some people describe that as feeling a bit like having a head cold. Your face will get quite puffy. And the other effect, which is slightly less desirable, is space motion sickness. Astronauts do get this as soon as they arrive on the ISS for a couple of days, where they're sort of throwing up or feeling very nauseous because suddenly you're in microgravity and your inner ear that you use for balance is completely messed up. Now the question is it worth it? Well, we also have the effects of flight on an unhealthy human. And one of the most worrying of these is the high G-forces. This could definitely affect the cardiovascular system because you've got G-forces from your chest to your back. And so anyone who can't really tolerate any exercise or can't tolerate G-forces on a centrifuge, probably not deal too well on a flight. The next part would be the worst case scenario, is called G-lock, so that's gravity-induced loss of consciousness. And this is when the pressure means that the heart can't actually pump enough blood to the brain and you lose consciousness. Another issue would be hypoxia. This is quite a small sort of consideration because it would be similar to conditions on a commercial flight, but it could cause issues in anyone with respiratory or blood diseases. So one of the limiting factors is that currently most of the research is on young and healthy people. And the other limiting factor is also that we haven't done any research on suborbital flights because the commercial providers want to be able to sell tickets as soon as they can get those flights up, and they don't really want to send hundreds of people up for free just to do the research. And finally, the population that take these flights is probably going to be self-selecting in the sense that it's people that can afford it. It's about $250,000. So the types of people that might afford that are definitely older, might have a few different comorbidities. And then the final consideration is a bit more ethical. So the provider will want to be selling their tickets. And as a doctor, you might not be allowed to tell people that they can't fly. So we'll definitely have to be talking to the participants and making an informed decision for them to know the risks that they're undertaking and then deciding on whether they want to take the flight or not. So the next part that we're going to look at is the questionnaire. So we sent out a questionnaire to experts because we found the literature was definitely lacking. And as I said, there's never been any research like this before. And we actually got some great responses. So we got 19 responses, as you can see, from a broad range from military aviation, aeromedical transfer, some people who are working in space medicine and others who had a general interest in it. And we asked along the same lines as our literature review was researching, but they came up with some really interesting considerations. So I'll be going through a few of those on this table here. So first of all, existing conditions to consider that could be affected. As you can see, the list is quite exhaustive, but there are some really interesting ones. So vestibular disorders, that's because of the microgravity part when you get to microgravity and your inner ear is completely sort of messed up. COPD, that's because of the cabin environment. Hypertension because of the high G forces. ENT because of the pressure changes. Anxiety and phobias just because it is such a novel alien environment to be flying up to space. But some of the conditions that could be allowed under certain criteria were quite interesting in the fact that they highlighted you don't necessarily need to tell people that they can't take the flight, but they might just need to take some medication with them or be trained to deal with the high G forces on centrifuges, that kind of thing. Now, I put no-go question mark because Virgin Galactic might not want you to tell people that they can't fly because they want to sell their tickets. But any active infection is pretty self-explanatory, recent surgery as well. Intoxication, unfortunately, alcohol does reduce tolerance to G forces. So there won't be any drinking before, during, and probably at least a day after the flight, just to recover. Any severe osteopenia and osteoporosis, that's because of the G forces you're under, but also in the microgravity part. If you're flying around, you might hit something and you don't want to be susceptible to breaking a bone. And then the final two, anything that won't qualify for health insurance coverage shouldn't fly, and that's probably speaks a bit more to the Americans. On this side of the pond would probably think anything that causes a sick day from work you wouldn't want to fly. And then the last ones are probably definite no-goes, just because participants with uncontrolled epilepsy could cause risk to other participants, or chronic renal failure would definitely not enjoy the flight. The onboard and medical emergencies that the experts were talking about was really anything, anaphylaxis, hyperglycemia, all those things. One interesting consideration is that medication delivery will actually be very different on the flight. If someone has an inhaler or an EpiPen, they have to be able to use it when they're under 3 G forces if they need to, or if they're in microgravity or in different portions of the flight. So the medication delivery is probably more of a consideration than the medication itself. The pre-flight checks, we just asked them what they would recommend, and there's the general sort of history and examinations. The class 1 or 2 medical is actually the medicals they do for pilots. And it was a consideration when we were writing ours up, but we actually determined that because the participant doesn't have to do the job of pilot, they don't have to sort of be as aware or as risk averse as the pilots need to be, then they won't need such a stringent medical. And a hypoxia challenge was an interesting one, because pilots do that all the time to test if they can deal with the hypoxic conditions that they're sometimes under. So we could test anyone that's susceptible to hypoxia and see if they can deal with it, really. Some of the personal recommendations, so we could fit people out with anti-G trousers or train them in the anti-G straining maneuver. If anyone was on the centrifuge and struggling to deal with the high Gs, then they could be trained. The spacesuits that they use could have telemetry data, and then we could gather data, first of all, for the research that we're doing, but also inform us on any decisions we make in flight. And then the non-zero chance of being hauled by debris. I think that's definitely something that participants will have to be aware of. There is a lot of space junk and debris flying around at high speeds, and if there is an emergency, then participants will have to be able to themselves take part in the emergency and escape systems. And then the training we'll be going through a bit later, because we definitely did recommend training. The business and ethics side, again, was the balance between commercial interests and medical interests, and the right balance can be struck, but then there are currently no sort of laws governing this kind of thing. So Virgin Galactic could send anyone up that they wanted to, as long as that person signed that they was informed and consented to the fact that they were taking quite a high risk. So it's definitely something that needs to be addressed before we start sending tourists up. So if you spent $250,000 on this, how would it feel? So the first thing would be the 3 G forces. You'd feel a lot of pressure on your chest, pushing you into your seat. It would probably be quite difficult to move your arms or legs during that portion of the flight, and you definitely have to be strapped in. Some of the, as I said, on the centrifuge studies, they've reported discomfort and anxiety. So it might not be the most enjoyable part of the flight for many people. One of the worst case scenarios is any vision deterioration. So that's when you start losing peripheral vision in your eyes, because your essentially your heart isn't pumping enough blood up to your brain. The other part that you would probably enjoy a lot more is the microgravity. So as I said, it's only 3 or 5 minutes, but you would see the curvature of the Earth, and a lot of astronauts have come back and said that seeing that definitely shifts your perspective, and the fact that you can't see any borders from space. They all come back to be quite philosophical about it, but they're not sure quite how to describe it. So it's called the overview effect. And also floating around would just be really cool for those 3 to 5 minutes. Unfortunately, a lot of people would probably feel quite nauseous, and some people might throw up, but you can take like prophylaxis for that and try and prevent it by taking some medications. So finally, at the end of the challenge, we wanted to define medical standards in terms of the history, the exam and the tests. So I'll summarize those here. Thanks to Nina for these awesome graphics. On the left, we've got taking a commercial spaceflight participant's history. So you've got the general medical history, which is pretty self-explanatory. You'll want to know any recent visits to the GP, any allergies, medications, that kind of thing. We move on to systems-based because you definitely want to be checking all the systems in terms of gastrointestinal, musculoskeletal, and determining if anyone needs further testing. We'd move on to the spaceflight specific tests once they'd passed those. So how they deal with motion sickness, are they susceptible to G-lock, hyperventilation, claustrophobia, that kind of thing could cause an issue during a flight. And finally, social history in terms of alcohol, smoking and drug use. So moving to the center, we've got the physical examination, and that's also pretty standard in terms of the vital signs. You'd also want a full workup in terms of cardiovascular, respiratory and abdominal exam. Yeah, it's just a very thorough MOT. And on the right would be any extra tests that you'd have to order. So ECG, if you suspected that they might have a heart condition, wouldn't deal with the flight as well. Pregnancy tests that we spoke about earlier. So in-flight solutions, the first one would definitely be the engineering part of it, so you can control cabin pressure and temperature, and that has actually been shown to have an effect on G tolerance. An onboard AED, which is a resus device, would be great, but that would have to be tested as well, because you don't really want to send off an electric shock in a small cabin and not be sure how it works. A standard medical kit is pretty self-explanatory, and then participant has to carry their own medication, and as I said earlier, they're also going to have to administer that medication themselves. And then extra oxygen provisions, and for motion sickness you can give some preventative medications as well. So in summary, we'd recommend an initial questionnaire, then the history, physical exam. Our main sort of MO for this, for the pre-flight checks, was that the flight environment shouldn't endanger the participant, but they should also be able to safely take part in the flight and not be a danger to other participants. And that could mean extra training. So parabolic flights would be great for getting them used to the microgravity portion, but wouldn't simulate the 3G forces, whereas the centrifuge would simulate the high G forces, but wouldn't give you the microgravity. And just a simulator wouldn't give you any of the forces acting on your body, but could give you an idea of what the cabin will look like. A post-flight medical debrief is probably one of our most important recommendations, because that means the participant could share their own experiences, and the medical providers could gather data on how they dealt with the flight, and they could also adjust the pre-flight checks as they go, as they get more participants flying. So yeah, we definitely advise erring on the side of caution at first for the first few flights, and then having telemetry in flight can show you how people with different medical conditions deal with it, and you can start expanding your reach. The next part is going to be interactive, and hopefully it works. So we've got some hypothetical case studies. So I'll be giving you a little bit of information about a customer that wants to buy a ticket on these flights. And then if you just pop in the chat if you think they're fit or unfit to fly, and Adele should be able to read it out. And then if you don't say anything, she'll just have to guess. Okay, so to start with, a customer presents with a history of claustrophobia and a history of anxiety attacks, but he's flown internationally before with no incidents. Do you think that they are fit or unfit to fly?
So we got one person so far. Grace says unfit. Oh yeah, we've got a lot of people saying unfit to fly.
Okay. So the spacecraft is definitely much more confined than a commercial aircraft, and it's an alien environment, if you don't mind the pun. That could trigger an attack and pose an issue for the passenger. They would be fit if they had further testing, and they would definitely need to be stable, and their anxiety would have to be managed. But for example, a simulator of a cabin, they could go in and see the proportions of it and the kind of environment they'd be under, and they could decide themselves if they think they will cause an issue. So case 2, a customer presents with a history of kidney stones. A recent renal ultrasound scan showed a small unpassed stone in the left kidney. Do you think that they are fit or unfit to fly?
Similarly, we've got one more person saying unfit. Yeah, and a few more people saying unfit for this one as well.
Okay, yeah. So I would agree they would be unfit due to the pain and the possibility of actually passing the stone in flight due to the vibrations, which would not be comfortable and obviously has a risk of infection. So they would definitely need to wait until they pass that stone and then reapply in essence. And finally, a customer presents with diagnosed asthma. They bring their inhaler with them and their asthma is generally well controlled with a few acute exacerbations and no past hospitalizations. Are they fit or unfit to fly?
Yeah, and I think the general consensus is that they're fit. One person says fit if trained.
Yeah, absolutely. I love that. You got the message. Anyone with asthma should carry an inhaler, but obviously they have to be able to administer it under 3G or in microgravity. And that's a pretty unique environment to have to use an inhaler in. So they could do some extra testing to show them how that would work. Great. Okay, so finally, I don't know if you saw, but on Sunday, 4 astronauts launched from US soil in Crew 1. And this was on the SpaceX Dragon capsule. And it really is a very exciting development because it marks the start of cheaper and more accessible trips to space. Currently, well, before, the only trips you could take was on the Soyuz, and that cost about $75 million for a seat, which is pretty hefty. And the Dragon capsule is actually $20 to $25 million, which is still very expensive, but a lot more accessible. And it's opening the door to things like filming movies on the ISS, and they're even talking about building a hotel on the ISS. And that is the future of space tourism. Thank you so much for coming. If you have any questions, I'll be able to answer them, hopefully.
Excellent. Thank you so much, Eleanor. That was brilliant. I know you talk a lot about kind of informed consent and making sure that people understand the risks of what they're signing up for. But I couldn't help but watch a lot of that and think, I really want to go. Yeah, I know what I'm signing up for, but I really want to go. If anyone has any questions, feel free to fire them into the chat. Nina says, great talk, and I thoroughly agree. You did an excellent job. If you don't have a question, feel free to add into the chat whether, based on what Eleanor said, if you had the money, would you be up for buying a ticket on Virgin Galactic to go into space and experience weightlessness for 35 minutes? Yeah, I would totally, absolutely. You've sold it well. Are you secretly being paid? Are you on commission by Virgin Galactic to sell this? Alrighty, so I'm assuming nobody has any questions. Oh, wait, I spoke too soon. Keely asks, what are the emergency and escape systems you mentioned?
Great question, because they haven't really talked about that. And well, Virgin Galactic haven't really. It depends at what point in the flight there will be an emergency. So if you're still sort of flying up, then you can just turn around and fly back down if that is a problem. If you're in the microgravity portion, then you probably have to follow the standard flight profile back down. So that could be another hour or half hour of flight, just because when you're that high up, when you're flying back down, you can't just sort of land anywhere you want to. You have to predict your flight profile and that kind of thing. And also the faster you go down, the more G-forces you're under. So if someone is having an emergency where they wouldn't be able to deal with the G-forces, then they'll have to change their flight profile like fully and see if they have enough fuel for that and all sorts of considerations. But they haven't really talked about the emergency situations that might arise.
Yeah, and I think that's part of kind of screening and doing these medical checks, is to reduce the possibility of there being, or reduce the probability of there being a medical emergency in flight, because obviously that's very difficult to deal with, especially when you're in mass amounts of G-force.
Yeah, that's definitely the in all space stuff, is to try and prevent things happening.
I had a question myself. I'm not sure if in your project you considered if, say, perhaps you have a patient who, because you mentioned that you as medical professionals might not really be able to tell somebody you can't go.
Mm-hmm.
So I was just wondering, from yourself and from the other Paraboladies' point of view, if you had a patient who was palliative, so had some kind of terminal condition, I think you know where I'm going with this, yeah. And they fit solidly into the unfit to fly category, but they have complete capacity. They are well within their right to make decisions. They're fully informed. They understand exactly what they're signing up for. And there's a reasonable chance that this flight could kill them. Do you still allow them to fly?
I mean, it's up to the commercial providers if you're allowed to allow or not allow. So that would be up to them. I think as someone who would be assessing them, I would definitely talk to them about all the risks they're undertaking. As if I was advising the commercial providers as to how to deal with that situation as well, I probably would want to check out the legality of someone dying on a flight up to space. But again, there are there's no sort of controlling body at the moment, so there's no incentive to turn anyone around. But
yeah, this is true.
Yeah, I would definitely try and put them off, and that could mean putting them on a centrifuge or a parabolic flight and being like, it's probably going to be worse than this. And seeing.
Nina's mentioned that Professor Stephen Hawking did a parabolic flight and ended up needing supplementary oxygen. He was okay afterwards, but I can imagine his in-flight medics were nervous. Yeah, absolutely. Yeah. Wow. Imagine having that kind of pressure on you.
The rest of the cabin, and whether having lots of people around to look after one person could put the rest of the participants at risk, and it would not be ideal if anything happened, again, because the emergency procedures aren't really foolproof.
Absolutely, yeah, that's true. Lauren mentions, yes, more unwell equals more support people required, possibly need their own flight if they needed that much support, so it'd be so expensive. Then, you have a lot of stupidly rich people in the world, and if they're about to die and that's something that they really, really, really want to tick off their bucket list, this could be something that it could be the kind of problem that commercial spaceflight providers are.
I think it will be. They're already sort of facing lots of requests by people saying that they want to be able to smoke weed before the flight and that kind of thing. So I think you're going to deal with all sorts as soon as you open this up, but it's about having those checks in place beforehand and having also the law and ethics side of it sort of definitely written out clearly.
Yeah, absolutely. There's another question here from Aiden. It's a bit more personal question. How do you see your future in 10 years from now?
Well, hopefully I've graduated. So, I mean, that takes a 5-year chunk out of it because I'm in med school and it's going to take a while. And then after those 5 years, you've got 2 years junior doctor. So this is definitely a cop out. Every time anyone asks me this, I'm just like, you probably want to look at the 20-year mark. But 10 years, I would definitely love to be doing space medicine research. Whether that is as a flight surgeon is unlikely because, as I say, 7 years of those is taken up with training. But there's always work to be done in space medicine. And as I was showing, the area of space medicine is changing all the time, and space tourism will be a thing by then. So maybe Virgin Galactic will pay me to be a doctor on all their flights. That would be great. So we'll just have to, wait and see. I'm flexible, just like the space industry is.
Excellent answer. Flexible, just like the space industry. Very nice. If anyone else has any more questions, feel free to add them in. But just now, I'm just going to add a link. So that link will take you to our feedback form for tonight. Feel free to add any thoughts, anything that we can do better, anything that was particularly good, and we'll take it on board for all our future events. And there's also a part in there where you can add your email to our mailing list, and you can also add in your name to sign up to have a certificate of participation emailed out to you. And I would particularly recommend signing up to the mailing list if you haven't done so already, as we have some very, very exciting announcements coming up very, very soon. Eleanor has a very knowing look on her face. But yeah. Grace asked, how do I sign up? If you go to the link that I've just posted in the chat there and you fill out the feedback form, there's a section at the bottom for you to add your email, and we'll pop you onto the mailing list if you send that in. Not a problem. Alrighty. Does anyone else have any questions? Or are you all just counting out the pennies in your piggy bank to see how much more you need to save to go on Virgin Galactic? Because I know I am. But no. Brilliant. Okay. Thank you very much, Eleanor. You're an absolute star. Thank you also to all the other Paraboladies. We've had a brilliant month. I can't even believe it's been 4 weeks already. There's 2 of the sessions are up on YouTube already, and the next 2 should be up in the next couple of days. So definitely head over to our YouTube and check that out. You can find the links on all of our social media channels. And apart from that, thank you everybody for coming. It has been a lot of fun.
Thank you. Bye.